Hey everybody, Dr. Beyer doing Friday clinical rounds. Last week we talked about a patient, we talked about the history and the results that we got. And I mentioned in last week's video how, in contrast to how I have been doing the Friday clinical rounds, which is over 4 weeks, we're doing them over 2 weeks. So in this week we're going to talk about basically how I got the results that I got. We got fantastic results with this particular patient who was coming in on 5 different medications. 2 for diabetes, a synthroid, thyroid medication, 1 for blood pressure, and a cholesterol-lowering drug, a statin. And she had been feeling crummy for a lot of years, 50-year-old patient, for 18 years feeling crummy with a variety of symptoms, including headaches and fatigue and weight gain and brain fogginess, gut issues, things like that. And in a 4-month treatment plan, we got her reducing her diabetes medication, reducing her synthroid, and all the numbers better. And the way that I do that basically is to actually find out what the cause of the problem is. I mean, it's just ridiculous how many people are just getting drugs dumped into their system. The doctors don't figure out exactly why the thyroid's dysfunctioning. We do with the right labs. We do a comprehensive thyroid panel to figure out exactly which one of the 24 different ways that the thyroid can be dysfunctioning, how it is dysfunctioning for you. The medical approach recognizes 1, maybe 2 different ways the thyroid cannot work right. There's 24 different ways, but you don't know that unless you're working, the doctor doesn't know that unless he or she is trained in functional medicine. So we figure out exactly what the mechanism of dysfunction is. Like, for example, with this patient, she wasn't converting the inactive thyroid hormone, which is T4, to the active thyroid hormone, which is T3. Most people don't know that. Your gland produces 2 different types of hormone, but one's for the most part inactive. It has to get converted to the active form. And a lot of that conversion takes place in the gut. Well, lo and behold, she had an infection within her GI tract. She had the red flags of that on her blood test, so we did a stool test, found that to be the case, killed that infection, which of course helped her GI symptoms, but it also improved her thyroid function because the conversion from the inactive to the active thyroid hormone was better. You're not going to get that kind of approach unless you work with a doctor who does functional medicine, but that's exactly what I do. So with the right blood work, with the right training to evaluate that blood work, and knowing what, if any, specialty labs, like a stool analysis to see if there is any kind of infection in the gut, if it's warranted, we can figure out exactly what's going on and get people feeling a ton better within a 3 to 4 month treatment plan. That's what she did, a 4-month treatment plan. There's just no reason to continue to suffer. Don't keep doing the same thing over and over again expecting different results. That's a good definition of insanity. If you're continuing to suffer with a chronic health issue and you really want to get to the root cause of the issue and get it fixed and get feeling better, if you're tired of the madness, give the office a call. 815-469-8500. What I'm going to do is, for everybody who calls within a week, this video is being posted on the 12th of August. We're giving people until the 19th of August to give the office a call, and we'll do $50 off the initial evaluation, $50 off the initial blood work, which is a very comprehensive set of blood work. We'll do $50 off unless we bill through the insurance. If the insurance takes care of it, it's a no-brainer, but we'll reduce it by $50 if that's not going to be the case. So you're going to save a substantial amount of money, and more importantly, figure out finally exactly what's going on. Give the office a call. Take advantage of the offer. Got to give a call by Friday, August 19th, 815-469-8500.